The Iowa City Free Medical Clinic has been providing free medical care to the residents of the Johnson County area for almost 20 years. It occupies the entire basement and a small part of the first floor of the Wesley Foundation, which is the Methodist Student Center at 120 North Dubuque Street. A wide range of medical services are provided to men, women, and children by volunteer medical and lay personnel on Monday and Thursday evenings. The clinic operates as a family practice type center for low-income people who do not qualify for medical assistance programs or who aren't yet aware that they do qualify. For many people, the free medical clinic is the point of entry into the medical system. For many other people, this clinic is their only or their primary care center.
Whenever I need help, even though if it's a doctor on Monday and Thursday, I can come here, and I can always get a hold of them by phone. That's the main reason I like to come here, and I don't have to worry whether I have enough money or not. And if I can, I can make a donation, but nothing is ever asked of me, and I like that.
We see all ages of people for a wide variety of reasons. We have about 6,000 patient visits per year. The philosophy of Free Medical Clinic emphasizes patients' rights, informed consent, and confidentiality. Patients register first and fill out a health history questionnaire if they've never been seen by us. They don't need to tell the receptionist why they're here. They'll be called to a private table to discuss the reason for their visit. Persons who are here for an HIV test, which detects exposure to the virus that causes AIDS, are encouraged to register anonymously by using a fictitious name. Volunteer receptionists are always needed and appreciated. They're trained by us after being screened, and scheduling is flexible. Confidentiality is required and enforced. A unique aspect of our clinic is our system of patient guides or advocates. They stay with the patients throughout their visit here to ensure that their questions are answered, procedures are explained, their concerns are addressed, and they're treated with dignity and respect. The patient guides take a short medical history and vital signs and provide education, support, and advocacy.
I've been a patient guide at the clinic here for about 2 years. It's my job to take charge of the patient when they first come in, get their basic symptoms, try to get relevant information from them, things that they may not have thought of that could impact on their problem, and then get that information all packaged together for the examiner. And another thing that I do is try to clear up communication between the examiner and the doctor and the examiner and the patient. Sometimes the med student won't realize that the patient isn't really understanding what he's saying. And then I'm also supposed to sort of watch out for the patient's rights, make sure that he knows what he is supposed to get and so on. The reason I do it is it makes me feel good. It's my little way of saving the world once a week. And it's a good way to meet other people in the community I would never otherwise meet, both people who work here and the patients that we have. And there's lots of free black coffee too.
The patients tell us they appreciate the patient guides and the personal attention that they receive here. Both medically trained and non-medical people volunteer as patient guides after training and orientation by the clinic staff. They each volunteer 3 evenings per month for a minimum of 9 months. Exams are performed by senior medical students, physician assistants, and nurse practitioners in consultation with a licensed physician.
My name is Peggy Bala, and I'm a senior medical student, and I started volunteering at the clinic about 6 years ago as a patient advocate, and now work as an examiner here. There aren't enough adjectives for me to describe why I enjoy the clinic so much. I think probably the one angle that you always hear about when people talk about the clinic is that it provides a service to the community. But the other side of the coin is the service that it provides to the people who work here. Not only the opportunity to get to know a community-oriented project, but services many different aspects of this community, but also provides a free service to those of us who work here in that it extends your education in the truest sense of the word. Your medical education for those of us who work as examiners, but also perhaps even more importantly, your education regarding community concerns, the essence of which a lot of times comes down to very basic issues of medical care and its provision, especially for people who fall through social nets. And perhaps for me, the last 6 years have been an affirmation not only of that being a goal that's achieved by this clinic, but also one in which the people who are involved in the provision of that service do it with such affection, if that's not too corny a word. They provide it with a dedication and a sincerity that shows that altruism, I think, is alive and well in our city.
Examiners and doctors volunteer as often or as infrequently as they choose.
Thank you. Check your time. Good, head control. Let's see what Good. My name's Carla, and I work here on Monday nights in a free medical clinic as a staff physician. My training is as a pediatrician, although working here I'm also helping people take care of adults, as well as young adults and children. I find that it's a very satisfying place to work. People ask me, why do I work here, and why am I so enthusiastic about working here? I think for a number of reasons. I think certainly it's a very satisfying place to work in terms of, I think that you're meeting people and caring for people who might not otherwise be coming to medical care facilities. I think that sometimes either for cost or for dislike of establishment, so-called establishment medicine, or for other reasons they might be just staying at home and not getting any care. The population itself is very interesting for the variety of problems that they have. And I think that the people that you work with, because the vast majority of us are volunteer, you have a certain esprit de corps, camaraderie, working with one another to serve people and also to learn from our experiences. I think a third reason that I especially enjoy working here is that there's not such a technological emphasis on providing medical care that we certainly are trying to train our eyes and our hands and our ears well for providing high-quality medical care. And when we find that there are times that we need to send people for more specialized care and referral to the hospitals in town, that we certainly do that in a very logical manner when it's needed. We have people of many different backgrounds working here, people who are interested in medicine, medical students, social workers, pharmacy, and I think we all benefit from that. I enjoy teaching, and there certainly is a lot to teach and learn, and we certainly all learn from one another in doing it. It's a wonderful place to work.
We always need more volunteer physicians, especially those in family practice, internal medicine, or preventive medicine.
Can you open up and say the edge of tonsil tap?
Yeah.
That looks good. Your throat's a little bit red, but not too bad. Let me just come around the back and examine you here. Do you have any soreness in your neck?
Just on this side.
The right side?
Yeah.
Is that sore day?
No, it's not so bad. No, just a tiny little bit. I mean, it was a couple of days ago. It was more giving me more problem.
My name's David Pepper. I'm a senior medical student at the university, and I've been working at the free clinic for about 4 years now. It's a wonderful chance to use some of the skills I've acquired at the university, a nice chance to experience medicine in a different environment, and a nice chance to feel like I'm actually doing something for the community. You see a lot of common things here, a lot of sore throats, a lot of kids who have infected ears, a lot of patients with psychosomatic complaints, and a lot of real pathology. We have everything from the lab to the pharmacy, and it really gives you a sense of providing medicine. Because one of the most important things we do is provide medicine, and that's something that the free clinic has been a leader in terms of saying that healthcare is a right, and therefore patients shouldn't have to pay for it and shouldn't have to worry about the cost burdens of it, but instead can just come and get healthy.
Liability insurance is provided by the clinic for all of our volunteers. Lab techs are needed to volunteer in our laboratory to assist our paid lab worker, Jeff Kern. Scheduling for the lab is also very flexible. Registered pharmacists and pharmacy students are needed to volunteer about once a month in our small dispensary, and they counsel the patients about their medications. We also have a volunteer dietitian, Betty Dickinson, who counsels our patients by appointment. We're always open to the idea of providing new services if we have volunteers to provide them. HIV pre- and post-test counseling is provided by trained volunteer counselors who are knowledgeable about testing, about AIDS, safer sex, and a variety of AIDS-related issues. Ann Romberg is our AIDS Services Coordinator, and she can talk more about that.
The Free Clinic has been offering the HIV antibody test since 1985, shortly after the test first became available. Started out small, and now we're sort of our own separate service at the Free Medical Clinic. The Iowa Department of Public Health has designated the Iowa City Free Medical Clinic as an alternate test site. And we are the only alternate test site in Iowa that is staffed almost completely by volunteers. So we are very unique in that sense. We have 12 volunteers who work. We try to have 2 or 3 volunteers each clinic evening. That's each Monday and Thursday evening. And someone always talks to each person who comes here who wants to be tested for the HIV antibody. Usually in an evening we might see anywhere from 2 to 10 clients. And the volunteers work anywhere from 2 to 4 times a month. It is a walk-in service. You don't need an appointment if you are interested in being tested for the HIV antibody. We also offer anonymous testing. That means that we don't in any way, shape, or form have to know anything about you. You can just use a false name when you come, and then your test results are sent out with a number system. The service is also free, and we also talk to anyone who comes here who's diagnosed with any sexually transmitted disease. Steve is going to talk a little bit about what we talk about in the sessions.
When a person first comes into the Free Medical Clinic for the HIV test, they're often not quite sure exactly why they're here. First of all, they might not know exactly what the HIV test does. The test is administered to determine whether there are antibodies for the HIV virus in the blood system. And a person will come in here and say, well, they want the AIDS test. And the first thing we have to tell them is it's not a test for AIDS. It just is a test to see that you have antibodies for the virus. And the test does not mean that you have AIDS or that you ever will get AIDS. So I guess what I'm saying is that it's an educational process when someone comes in for the test. We have to often start from the bottom up in terms of AIDS education. If a person comes in here and they're not sure what the test is, that means that they may not be quite sure what the test is going to mean for them after they have the test too. And certain people will have a very high anxiety level about waiting for the results of the test because they may have had a behavior that was uncomfortable for them or that they don't want to talk about. So it's up to the counselor to kind of sort these things out and help the patient to decide just how much they need the test or whether they really want the test. We don't discourage or encourage anyone to have the test if they are uncertain about it. It's got to be the decision of the client. But after a client has decided that he will want to have the test, then we can go on and talk about the behaviors that brought them in for the test, and safe sex practices in particular. The clinic itself is not judgmental about anyone's behavior. We are just concerned that no one get the virus from another person. Most of the people who come in here are very concerned that they don't give the virus if they have it to someone else. And it usually requires some amount of courage on the part of people to come in here to get the test.
There are a lot of personal benefits from volunteering at the Free Clinic. You gain valuable experience in medicine. It's also a lot of fun. It's a constant learning experience. You meet a lot of interesting people, both patients and volunteers, and you can see the results of your work immediately.
I'm Sandy Pickup. I'm the financial coordinator of the Free Medical Clinic. I just got done doing the budget recently, and I guess it's interesting maybe for people to know that we operate on about $100,000 a year. Our money comes from Johnson County and the United Way, and private donations as well as patient donations. Patients that come to the clinic oftentimes leave donations. And it's really pretty remarkable that we operate on such a small budget, considering all the things that we do. Some of the things that we could do if we had more money would be expand the facility possibly and help people pay for x-rays, possibly more medications, and it would be really nice to make the building wheelchair accessible. If you would want to send a donation to the Free Medical Clinic, you could do that at P.O. Box 1170, Iowa City, Iowa 52244. All donations would be tax exempt as we are a nonprofit organization.
Maintaining the clinic is a constant struggle, and we need the continued support of the good people of this area through donations of time, money, and supplies. That community support is what has kept us operating successfully for almost 20 years, and it's greatly appreciated by the staff, volunteers, and patients.